Good evening, everyone. Happy Saturday. I'm Dr. Vivian Asamoah, and welcome to Gut Over It. I'm a gastroenterologist in Katy, Texas, and I specialize in gastroenterology and functional medicine. And this month, in the month of February, we are talking about a GI topic every evening. It's a personal challenge that I've set for myself, and I'm learning so much. It's really been very great. So we just finished week one, and there was a lot of popular demand for leaky gut. So I'm going to talk about leaky gut this evening, and it's Saturday night, so we're going to make it quick and so everyone can get on with what they're doing. So thank you all guys for joining. If you're watching this live or you're on the replay, please click on the like, share some love, put in some comments. And tonight's word of the night is leaky gut, okay? So I wanted to share a little bit about my day today because I'm not sure I've really discussed our functional medicine program, and we had a couple of people asking us, so I thought I'd talk about it. So as a gastroenterologist, I practice traditional, conventional GI endoscopies and working patients up for GERD, but we kind of have a different approach at our practice where we really look at trying to understand the root cause. And I think as my career is evolving and as I jumped into the world of integrative medicine and functional medicine, I was particularly interested in helping people with chronic GI issues. So these are people who have had chronic gut issues for a long time, can remember a trigger, and have had a lot of conventional testing, a lot of diagnostic workup, but are still not being able to get to the root cause and also not feeling better. And very often these people have a fear of eating. So that's kind of what I kind of want to focus on in the functional gastroenterology practice. I know that I'm a gastroenterologist. I hope to continue to learn in my field and really be very good at that aspect of it. So as a functional medicine provider, I've decided to focus on functional gastroenterology. So today is one of those days where we have, I did consults this morning and this afternoon, actually all day, up till about 3 o'clock with my superb dietitian, Bianca. And we jump on these consults together for people who have these kind of chronic gut conditions and are fed up and need help and want to get resolution. So we see a range of patients. So sometimes we'll see people with inflammatory bowel disease and just have failed conventional treatment or don't want conventional treatment and want to try the nutrition route. And I want to put out there that I always consider conventional treatment and integrative treatment as a combination, as an adjunct. I really believe it's a blend of both worlds that gives our patients the best outcomes. So if I feel that somebody really needs to be on a prescription medication because their inflammatory bowel disease is severe, I will prescribe. But in addition to that, I will focus on the diet. And so the odd thing is that, most of the time conventional doctors will just do medicine, and say, oh, don't worry about the diet, eat whatever you want. And then sometimes alternative providers will just focus on supplements, nutrition supplements, and start pulling patients off their medications when they really need it. And that's also a problem. So I try and combine both. And I start with the least toxic, regimen first, and then we evolve. So our visits are, most of our patients are in our 12-week signature program, which has been going great. We have just graduated our first set of patients who just completed the program and are doing wonderful. And I'm excited because in the month of March, we are going to be putting together a roundtable of all these patients who went through the program, got gut healing and gut relief, and just doing like an online testimonial about how it went, what they went through, what the challenges were. And I think it's going to be phenomenal. So I'm really excited about that. But in terms of the functional gastro program, it's been an evolution at our practice. I realized how important it was for me to really be very involved and lead the consultations myself instead of assigning it to someone else, because the medical knowledge and the medical background and being able to understand medications and how it affects what their cardiologist says, their endocrinologist says, their rheumatologist says was extremely important. So I kind of taken that on as an extra, but I'm absolutely loving it. And I am learning so much from patients. Like just, our first consultation is a 90-minute consultation, and we go from birth all the way till today. Kind of looking at what were the triggers over time. Were you on antibiotics? Was there personal trauma in your family? Were you exposed to environmental toxins? All of this helps us build and really understand why we've arrived where we've arrived. So today we saw a patient with MS with gut issues. We saw Crohn's disease with gut issues. We saw Candida overgrowth. And we're just starting the treatment, and we're really excited about it. So I'm so glad to see so many people on. Thanks for joining me tonight at Gut Over It. And we're going to be talking about leaky gut. There was a lot of personal requests for leaky gut, and it kind of is really aligned with what I'm doing in functional medicine. So I thought today was the perfect day after a full functional medicine day. And if you guys want to learn more about our functional gastro program and our 12-week signature program, please call our office, visit our website, send us a message, and we can share more. And there's a huge focus on nutrition there. And so that's going to be, it's really helpful information. So let's dig right into it. All right. And please hit those likes, share some love, put in a comment. And the word of the night is leaky gut. But I will say, when you guys go see your doctors, because we're talking about how to bring this question forward to your GI docs and your PCPs, the word leaky gut is kind of like, kind of frowned upon. It's kind of looked at as just, is it a real diagnosis? And when I think you mention it to medical doctors, they're kind of like, does that exist? But it does exist. The word you want to use when you go see your doctor is, you don't say, do I have leaky gut? You say, do I have issues with my intestinal permeability, doc? And they will listen to that, because there's so much research out there about intestinal permeability issues, but that really is leaky gut. That's all it is. But there is a lot of data out there. There is evidence, there is research, there are mice studies, there are human studies. It exists. And I know it exists because I've done the research and actually had to do a national talk for a gastroenterology association on this particular topic, the gut-liver connection. And I learned a tremendous amount of information that I did not learn in fellowship, like in training. So there's a lot of stuff coming out there. And I really do believe that this is stuff our alternative docs already knew. This is information that our chiropractors have known about for a long time. Our naturopathic physicians have known for a long time. Our dietitians have been on board with. But I don't think in conventional medicine, we really made the connection between the intestinal permeability issues and systemic issues, right? General issues that go on. So let's talk about that a little bit. So what is a leaky gut? Just let's think about it a little bit. The intestinal, so we focus on the small bowel, the small intestine, and it's made up like a very thin layer of cells called enterocytes, right? And imagine they're like little Lego blocks, and in between each Lego block, there's that little attachment, like the little hook thing, or maybe say cement, right? And this cement is what keeps them all together really nice and tight together. And some of the things that actually keep the cement together are called tight junctions, right? But if there is a break in the tight junction, that is what we call leaky gut. And there can be a break in the tight junction or intestinal permeability for many different reasons, okay? Hey guys, so good to see you guys on. Please leave a comment, leave a like, and go ahead and put questions in so we can talk about everything. And these intestinal cells have several jobs, right? They're called enterocytes. We kind of think these cells are just there to absorb food. When you digest and absorb, they just absorb the nutrients, but they do much more. They secrete, they have hormonal capacity, they have immune capacity. So when there is a break in that tight junction, it can really affect all of those things: the immune system, the hormonal flow, secretion, and absorption. And a clear example of leaky gut is celiac disease, right? So that's when someone eats all this wheat their body reacts to it. You start seeing a breakdown in that membrane. You clinically, even, when you scope these patients, you can actually see destruction in the lining. It's all like broken, their erosions and everything. And they have a lot of reactions because the barrier is not intact, and everything that's flowing inside this barrier starts to ooze out. And this could be inflammatory cytokines, so inflammatory products, something called MAPs, so microbial antigen peptides products. And when it oozes out, what does it go into? The bloodstream, right? That is the barrier that sits right next to this intestine. So the breakage in the intestinal wall leads to things seeping out that then go into the entire body and can cause systemic issues, right? So that's why it's such a big deal. We're realizing, and that's why everyone says the gut is so important. It really is, because it can really just spread, illness and disease and inflammation everywhere else. And so some of the symptoms you can have when you have leaky gut: bloating. You can have issues with brain fog, diarrhea, constipation, acne. There's, allergic reactions, hives. And we know that it can also trigger autoimmune disease. So that disruption leading to that immune push into the bloodstream can cause neurological issues, skin issues, autoimmune issues, gut issues, everything, right? But what I learned today is that leaky gut is not just an entity, like it's not just a fixed state. Science is actually showing us that our gut, the intestinal permeability, is in a constant state of flux, right? So today you could have antibiotics and NSAIDs like Motrin, Aleve, or Advil, and those are triggers for a mild leaky gut, right? Or you could have celiac disease and eat gliadin, right, gluten, and have a more severe leaky gut. So there are kind of different stages of this intestinal permeability, and not all of it is necessarily bad. Not all of it is permanent. A lot of it is reversible. So if you're on antibiotics for 10 days, you've got some leaky gut, you stop the antibiotics, you take probiotics, it restores and repairs itself. So it's a dynamic process and not just isolated. So another example, if you have dairy intolerance, right? And really from the casein, the protein, and you drink milk, that day, you may have some leaky gut. You may have, if we look at your cells, there may be leaky gut. But if you don't have it tomorrow and the day after, your cells restore and you're going to be okay. So it's not a permanent issue all the time.